What is health? If you'd have asked me 15 years ago when I became a dietitian, I would naturally think of the doctor's office. I would think of healthcare, which is not really healthcare, it's really sick care. Even going to school to be a dietitian, I learned how to manage disease. We didn't have a big focus on optimizing health, and I definitely didn't understand how sleep and nutrition and support system all connected with each other to help someone become the best and healthiest version of themselves. Today I want to talk about what is health. Health is the outcome of habits. It's not the absence of disease, it's the ability to thrive throughout one's lifetime. When we think about health, we should really think about a holistic approach to health. This is why we have the Healthy Steps Nutrition Framework. This focuses on 6 pillars of health: nutrition, sleep, mindset and stress management, exercise, support system and community, and lastly, our lifestyle. The culmination, helping you become the best and healthiest version of yourself one step at a time. So when we think about habits, what are habits? There's those automatic responses when we get in the car, we buckle our seatbelt and we don't have to think about it. About 40% of our daily actions are habits. They're automatic responses. And I'd venture to say the reason why so many people are on the sickness side of the sickness, wellness, fitness continuum, which we'll go through in a second, are because those habits, the 40% of the actions that we're doing every single day, are not moving us closer to fitness. They're moving us closer to sickness. When we create a plate, what does that look like? Are we grabbing a drink that has a little bit more sugar in it? Are we loading up our coffee with extra sugar in it? Are we sitting down all day? Are we limiting the amount of sleep? And it's all kind of coming together, moving us closer to sickness. I have a question for you. If we think about the US population, what percentage of people would you say are between the sickness and wellness side? Percentage of the US population. We know that 60% of the US population is here. They already have one chronic disease. 40% of people have 2 or more chronic diseases. But what percentage of people are not necessarily in great metabolic health, but metabolically unhealthy? Maybe they're not there yet, but they're on their way there if they don't start changing their habits to create a healthy lifestyle. It's got to be more than 60%. What do you say? 70, 75? 93% of people are on this side of the curve. I'm on a mission to change that. Because if we are on this side of the curve, we're not going to be able to live life to the fullest. So how do we know where we're at? Well, the first thing that we want to do is go get our annual checkup, get our annual blood work, see where we're at, get a good baseline. We look at markers like our A1C level. This is our 3-month average of our fasting blood sugar. This is a direct correlation to diagnosis of diabetes or prediabetes. We want to get that number. We ideally want it to be below 5.7. If it's above 6, we're going to be in that diabetic range. So where is that? We also look at blood pressure. One of the things that you can do super easy without going to a doctor's office is looking at your blood pressure, looking at your body fat percentage. Now, as females, we need a little bit more essential body fat. We need this for hormone regulation. If your body fat percentage gets too low, start losing your period, and you can cause some other issues by having a too low body fat percentage. But most people's body fat percentage, also BMI, is elevated, which directly leads to more chronic diseases. Where do you get your body fat percentage done? We use an InBody at Healthy Steps Nutrition to be able to track. How often should you track it? I'd recommend once a month. Typically, people that are doing our nutrition coaching program, losing about 1% body fat per month is super realistic. So let's say we did our body fat percentage test and my body fat percentage was 35%. And my goal was to get down to 25% body fat, losing 10% body fat. Very realistic goal. About 10 months to be able to do that. Could be faster, could be a little bit slower, but about 10 months. We want some realistic goals. Now, could you take medications like GLP-1s and move some of these things faster? Maybe, but that comes with a cost. When people are on GLP-1s, the research shows that they're losing between 25 and 39% of their muscle mass in just a year. That's like aging 25 years in just 1 year. And we know that if we have low muscle mass, it increases our risk for mortality as we get older. So preserving our lean muscle mass is so important. It's why we need to do strength training. It's why we need to make sure that we're getting enough protein and eating quality foods, because we could be losing weight, or it could be the right weight, technically, or a healthy weight, but inside, we're not exactly the healthiest person. So when we think about the sickness, wellness, fitness continuum, we want to have a baseline. We want to see where are we at on this spectrum, and we want to work our way closer to fitness. Because we know that if we are taking control of our health and we're overall at this fitness, we're going to be harder to kill. We're going to be able to live life to the fullest. We're not going to have all those medications and issues that come with chronic diseases. So what is health? Health is the outcome of our habits, and it's not just nutrition. It's not just going to the gym. We have to look at this 24-hour-a-day approach. We can go to the gym and bust our butt and do a really good job building strength training, but if we're not addressing the other 23 hours of the day, we're putting a cap on how we can best become a better version or a healthier version of ourselves. If you're thinking all of this makes complete sense to me, but I really don't know where to start, this all is something that I've been struggling with. I've been trying to do it on my own for years, and I just need a plan. We would love to help you at Healthy Steps Nutrition. The way our nutrition coaching program works is you get paired with a coach. They're going to do a full assessment and help you create a plan that's realistic for you, and then they're going to keep you accountable. Through the Healthy Steps Nutrition, doing check-ins every single week. You have daily habit tracking. There's educational videos in there. They're about 2 to 3 minutes long, simple tidbits so that you can make health a way of life. Of course, we've got some healthy recipes too. You've got calls and check-ins with your coach so that you can have the support that you need to make health a way of life. Getting started is super simple. You'll just click the link below and book a discovery call today.
Book a discovery call!
Yeah.